Dear friends, wish you all a great day full of positivity. As there now appears to be a ray of hope at the end of the dark tunnel, the announcement and optimism of a potentially effective vaccine against COVID-19. As cases continue to rise and concerns continue to grow, it is very important that we do not let our guard down and allow the virus to get an upper hand. Hence, to avoid that, I will share with you today extremely simple, practical interventions, popularly known by the mnemonic SMS V3. S stands for sanitization of surfaces and self. Surface sanitization is achieved by using 1% hypochlorite solution or disinfectants and using it for sanitizing the walls, tabletop surfaces, handles, doorknobs, etc. Contactless sanitization of surfaces can also be achieved today by an innovative device called as the ultraviolet C radiation chamber. This works on the principle that the ultraviolet C light, it destroys the virus DNA and then the virus cannot replicate. UVC chambers today are being used to sanitize stationery, currency, Tetra Paks, mobile phones, wallets, you name it. In 2 to 8 minutes, one can achieve 99.99% sanitization, worth buying for home and office. Sanitization of self can be achieved by hand washing with soap and water thoroughly for 20 seconds. If soap and water not available, then one can use the sanitizer 70% based alcohol. Hand washing can be done every 3 hours and sanitizers can be used every 1 hour. Sanitizers can also be used before eating, before touching the eyes, nose, mouth, before wearing a mask. Also, after completing the act of eating, after taking out the mask and disposing the mask, after defecation, and after touching potentially contaminated surfaces. Coming to the next component. Today, WHO and CDC both advocate wearing of masks to protect others and even yourself, because this helps in reducing the number of cases and deaths all over the world. If a mask is worn snugly around the face, covering the nose and mouth, then it is highly effective. Most effective is the N95 disposable mask, followed by the triple layer disposable mask, followed by the reusable cloth mask, in that order. The next component is social distancing. It's a challenge to maintain social distancing. 6 feet of social distancing is to be maintained, but I will tell you an excellent tip to maintain. You can download an app for Android phones known as the 1.5 meter app, where if you download on your phone and keep your Bluetooth on, it will alert you by a beep if the distance of 6 feet is violated. Works excellently. Do use it and protect yourself and others around you. You need to be vigilant about this virus so that it doesn't get an upper hand on you. If you or your family members are not feeling well, remember, a pandemic is going on. You may be suffering from COVID-19. Please contact your doctor immediately. Act fast so that you can test and detect fast, isolate and treat fast, and then trace and track your contacts fast for home quarantine of contacts. And if the contacts turn positive, then follow the same steps that I've mentioned above to control and contain the virus. Remember, the earlier you act, you will get free of the virus earlier and you will not affect your near and dear ones. Remember, it's a real dreadful virus. We need to act fast. Acting fast is the key to overcome the virus effects and side effects. The next component is ventilation. Now, before I explain about ventilation, I must tell you how COVID-19 is actually spreading. It has now been confirmed that airborne transmission of COVID-19 is taking place via droplets and via aerosols. A droplet is 300 microns and is usually emitted by coughing and sneezing. But one aerosol is actually very small in size, it's 100 micron. It is said that one droplet means 1200 aerosol particles. They are so small and fine. And these aerosol particles, they remain afloat in the air for hours. And if they have virus particles in them, then others can inhale these virus particles and get infected. So the aerosol transmission increases exponentially with the following acts: breathing, followed by speaking, followed by shouting, followed by singing, followed by coughing, followed by sneezing, in that order. Also, the aerosol transmission increases with the time duration in enclosed small spaces with poor ventilation. Hence, it is best to avoid staying indoors for long periods, especially in closed spaces where there's no ventilation at all, where there's not even mechanical exhaust ventilation, which will allow the air from outside to enter into the room or space and exit out of the room or space. If this is not happening, then there are high chances that aerosol transmission will be very high in such spaces. Also, in enclosed small spaces where ventilation is taking place with split air conditioners, which happens in restaurants, pubs and bars which are crowded, here these also can spread the virus. So it is very important, because here the aerosol transmission can take place by the unidirectional draft of air from the split air conditioner from asymptomatic carrier. The virus can be transmitted to long distances in the same room in such spaces. So best to avoid eating out and going to restaurants, pubs during this pandemic. Many of my patients ended up going to restaurants for dinners, and then one of them got infected, and then everybody had to be tested. So why have this tension? So please avoid during the pandemic going to such places. So another important thing about ventilation is in your car when you're traveling. If you're the driver and you're having the AC on, well, it's fine. But if you're the driver and there are other people traveling with you, if you're an asymptomatic carrier or a symptomatic carrier, you could spread to others. So switch the AC off and keep the windows down. If your driver is driving, again, you need to keep the AC off and the windows down. If you're traveling by public transport, keep the windows down if feasible and maintain social distancing. When you visit out of the home, please ensure that you wear a mask. Avoid using crowded elevators if possible, because the aerosol transmission can take place here. Use the staircase. Also, avoid crowded places. Avoid large gatherings of people, because these are potential super spreading events. Please do not go here. Also, avoid or limit interaction with people. They could be your clients, they could be your colleagues or customers. If you can have a meeting online, please go ahead and have the meeting online. Avoid interaction with people. If at all you need to have interaction with people, reduce the frequency of interactions, reduce the duration of interaction. If you can finish the interaction in 5 minutes, best. 5 to 10 minutes max. And if it's a close conversation during an interaction, well, make sure that you also have a face shield. But remember, avoiding interaction is the best. If you want to know more in detail, there's an article about the same on the Daily Eye in the health section. How to Keep the Virus at Bay by Dr. Kishore Madhwani. You can please go through this article in detail. It will give you some more information on how to maintain SMS V3. SMS V3 is the solution for transformation to the new normal for safer working today and also tomorrow when the vaccination arrives. Before I conclude, I would like to tell you that those of you who have contracted COVID-19, please ensure that you get your blood test done, because this virus is making the blood thicker and blood clots may cause complications like pneumonia, kidney failure, heart attacks, cardiovascular complications and strokes, even paralytic attacks. So please be sure that you follow up with your doctor, do the investigation which your doctor advises, and take the proper medication. Also, after the acute phase is over and 2 months later, you're on the post-COVID-19 phase. Well, many patients are developing heart attacks and strokes. So be sure that you're in touch with your doctor and get yourself investigated every 2 months with blood tests, and take medication if required, and counseling for mental health problems if you're having features of COVID-19 syndrome. And before I conclude, I would like to end with a social message. The fate of this virus will be decided by what each of us will collectively do in a responsible and transparent manner, locally, regionally, nationally, and globally, in the interest of humanity. And then only we will be able to successfully get over with COVID-19 and conquer it. Wish you all the very best for the future. Thank you.